Ladies, if you're over 65, the way you speak at your medical appointments could be putting your health at risk, and no one is talking about it. I've seen far too many older women walk into my office and unknowingly sabotage their own care simply because of how they communicate. In this video, I'll walk you through the 7 biggest communication mistakes older women make at the doctors and how to fix them. Backhand index pointing, right? So stay with me until the end, because mistake number 7, it's something even smart women do without realizing it. Before we start, make sure to like this video, subscribe, and in the comments, tell me, have you ever left an appointment feeling unheard? 1. Speaking too politely and not being taken seriously. I've lost count of how many older women I've seen come into my clinic and speak with such kindness, humility, and gentle manners that you almost want to give them a gold star for being the perfect patient. But let me tell you something a little uncomfortable. Being overly polite in a medical setting doesn't help you. It hurts you. Let me explain why. Doctors, especially those in busy practices, are trained consciously or unconsciously to triage urgency. We're listening not only to what you say, but how you say it. So when a woman walks in and says something like, "Oh, it's probably nothing, I just didn't want to waste your time," that automatically registers in our brain as low priority. We're human too, and if you're signaling that it's not a big deal, we might unconsciously agree. But here's the twist. Many of these probably nothing cases turn out to be something. A nagging cough becomes early lung disease. A little fatigue turns out to be untreated diabetes. It's not your job to decide how serious something is. It's your job to present it clearly. You don't have to be rude. You don't have to storm in and shout. But you do have to be assertive. Instead of, "I know you're busy, I just thought I'd ask," say, "I've had this issue for 2 weeks, and I need to find out what's causing it." That simple change in tone shows that you value your time, your health, and your body. And it teaches your doctor to take you seriously because you take yourself seriously. 2. Using vague descriptions that lead to misdiagnosis. Let's talk about a classic example of how vagueness can lead to poor care. A woman came to see me, a lovely 72-year-old. And when I asked her what brought her in, she said, "I just haven't been feeling myself lately." So I asked a follow-up, "What do you mean by that?" She replied, "I don't know, just a little off." Now, I appreciate her honesty, but as a doctor, I need detail to do my job. That phrase, feeling off, could mean anything: fatigue, anxiety, dizziness, nausea, low blood pressure, a heart rhythm issue, even early dementia. It's like saying, "My car is acting weird," and expecting the mechanic to fix it without opening the hood. I gently encouraged her to be more specific. And eventually she admitted she'd been having dizzy spells every morning when getting out of bed, plus trouble remembering small things like where she put her keys. And that was a major red flag. Turns out she had low blood pressure from a medication issue and the early signs of vascular cognitive decline. If she hadn't opened up, we might have brushed it off as aging. So here's my advice to you. Be as precise as you can. Before your appointment, write down what the symptom is, when it started, how often it occurs, what makes it better or worse, and how it's affecting your daily life. That's gold for your doctor, and it could be the difference between a brush off and a breakthrough. 3. Not speaking up when something feels off. There's something I hear all too often, and it always makes my heart sink. A patient will say, "Oh, I figured it was just my age. I didn't want to make a fuss." I assume this kind of thing happens when you get older. Let me tell you right now, just because something is common doesn't mean it's normal. Yes, aging brings changes. Your joints may stiffen, your sleep may change, and your skin may thin. But you know what's not just old age? Chest tightness, sudden fatigue, blurry vision, unexplained weight loss, new digestive problems, severe mood swings, falling often, The danger here is normalization. You experience something new or strange, and instead of questioning it, you quietly absorb it. You adapt. You endure. And that silence, it delays diagnoses. It gives preventable problems time to grow into dangerous ones. I once had a woman come in who'd been feeling pressure in her upper chest for a few months. Nothing unbearable, just enough to notice. She assumed it was arthritis or maybe reflux, but when she finally brought it up, it turned out to be a partial blockage in a coronary artery. One bad day away from a heart attack. Please listen to your body. If something feels wrong, it probably is. And the earlier you speak up, the better the outcome. 4. Downplaying symptoms to avoid looking dramatic. There's a quiet epidemic among older women. It's not a virus or a disease. It's the fear of being labeled dramatic. I see it all the time. A woman comes in with real, severe symptoms, but instead of owning them, she packages them with disclaimers. It's not that bad, really. I'm probably overreacting. I'm sure you've seen worse. You know what's really happening? You're protecting me, the doctor, from the burden of your pain. You're trying not to be too much. You're worried about taking up space. But let me tell you something with full sincerity. You are not too much. Your health is not an inconvenience. Your pain is not a punchline. I once had a patient who came in complaining of mild abdominal discomfort. She rated it a 4 out of 10, but her face told another story. She was pale, tense, and wincing with every movement. After pushing gently, she finally admitted she'd been in severe pain for days, but didn't want to make it a thing. That pain turned out to be acute diverticulitis. It required a hospital stay and antibiotics. Had she spoken up earlier, we could have avoided that altogether. Minimizing your symptoms doesn't make you strong. It makes it harder for us to help you. So please, give us the full picture. If it's an 8 out of 10, say it's an 8. If it's waking you up at night, say that. If it's affecting your mood, appetite, or movement, say it all. You deserve to be taken seriously, and that starts with taking yourself seriously. 5. Letting someone else speak for you when you shouldn't. Now, let me be clear. There is nothing wrong with bringing a loved one to a medical appointment. In fact, I encourage it in many cases. Having a second set of ears can help catch things you miss, and it's comforting to have someone by your side. But there's a subtle shift I've seen in older women that worries me. Somewhere along the line, many start handing over the entire conversation to their children, spouses, or carers. And in doing so, they lose control of their own health narrative. I remember one appointment vividly. A daughter brought in her 75-year-old mother. The mother was completely capable of speaking, thinking, and expressing herself, but the daughter answered every question before her mother could open her mouth. What symptoms has she had? I asked. She's been dizzy. How long has it been going on? About 2 weeks. I eventually turned directly to the mother and said gently, "Do you agree with that?" She smiled weakly and said, "Well, actually it started about a month ago and I blacked out once." Huge detail, completely missed. Here's the problem. When someone speaks for you, they might not get it quite right. They may leave out emotional details, downplay pain, or forget timelines. They filter the story through their lens, not yours. Even worse, when you fall silent, doctors might start addressing your companion instead of you. And when that happens, you risk becoming invisible in the very room that's supposed to center you. Unless you're cognitively impaired or very unwell, you need to lead the conversation. It's your body, your life, your health. Let your loved ones support you, but don't hand them the microphone. Speak up. Interrupt if you have to. Say, "Actually, I'd like to explain that myself." Because no one can tell your story better than you. 6. Failing to ask follow-up questions. Here's a truth that might surprise you. Doctors don't always explain things well. Not because we don't care, but because we're trained in a language that's often clinical, rushed, and full of jargon. We throw around words like benign, inflammation, mild degeneration, and expect patients to understand what that means for their life. But many older women don't want to seem difficult, so they nod politely and say, okay, even when they're completely confused. That's a big problem. I once had a patient leave an appointment thinking her diagnosis of moderate stenosis meant she had cancer. She spent 2 weeks in panic mode, losing sleep, dreading the worst, because she didn't ask what the term meant, and I unfortunately didn't clarify it well enough. Here's what I want every senior woman to remember. You are entitled to understanding, not just information. Understanding. That means, what exactly does that word mean in simple terms? How serious is this? Is this something that will get worse? What are the treatment options? What should I look out for? How will this affect my daily life? If you don't understand what your doctor said by the time you leave the room, don't leave. Ask. Clarify. Push back if needed. Doctors work for you. You are not there to impress us or make us comfortable. You're there to get clarity about your body and your future. And good doctors respect patients who advocate for themselves. In fact, those are usually the ones who live longer, manage chronic illness better, and avoid unnecessary hospital visits. So next time you're at the doctor, don't just nod and leave. Speak up, take notes, and don't go until it makes sense. 7. Not bringing notes or leaving without them. I want to share something practical now, because this mistake is extremely common, yet completely preventable. When older women come into appointments without notes or leave without written instructions, they forget things. That's not a character flaw. It's just how the human brain works, especially under stress or in unfamiliar environments. Let me give you an example. I once diagnosed a woman with mild heart failure. We had a 30-minute conversation about medications, fluid monitoring, daily weighing, and sodium restrictions. She nodded the entire time. She even said she understood. But when she came back 2 weeks later, her ankles were swollen, her weight was up, and she had no idea what fluid retention meant. When I asked, "Did you do the daily weighing?" she said, "You wanted me to weigh myself." The truth is, she simply forgot. And that could have led to a hospital admission. So here's the rule. Write everything down. Before the appointment, jot down a list of symptoms with approximate dates, specific concerns or questions you want answered, any recent changes in medication, diet, or energy levels. During the appointment, either write down what the doctor says or ask them to write the instructions for you. If your memory isn't great or if your handwriting is shaky, bring a small notebook and ask your doctor to jot it down for you. Most will gladly do it. Or ask your companion to help record it. And afterward, review those notes. Keep them in one place. Bring them to your next visit. Your health is a long-term story, and your notes are the journal. Without them, you're relying on memory. And let's be honest, even doctors forget things if they don't write them down.